Good evening. Welcome to Hope for Healing. I'm your host, Dr. John Stracks, joining you from my office here in Chicago. And for those of you who don't know me, I'm a physician who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. If you'd like to learn more about my practice, I do practice telehealth, and my staff will be happy to talk with you. You can find more information at our website, drstracks.com. This Hope for Healing video podcast series is one of many joint efforts between me and the folks at Curable. For those of you who are not yet Curable users, Curable is an amazing app that offers science-backed techniques for chronic pain recovery. We've been working on this together for about 6 years now, and we created this video series because we want to help people in pain understand the connection between what's happening in their life and what's happening in their body. Today, my guest on the show is Dr. Les Aria. Dr. Aria is a pain psychologist at Kaiser Permanente Medical Group in Northern California. He took the lead in redesigning their chronic pain curriculum to incorporate modern pain science. Dr. Aria, I'm looking forward to hearing more about your story and talking to you this evening. And thanks so much for joining me on Hope for Healing.
It's a true pleasure to be here. I'm actually very excited to be part of this.
I'm glad. And very important question that I did not ask you as we were warming up, but do you prefer Les or do you prefer Dr. Aria?
Oh, Les. So much easier to pronounce.
All right, you can call me John then.
Great, John.
So let's start a little bit with your own experience. And you've been working in this field for quite some time, and you've been at Kaiser for, I think, a couple of decades. And I know that you've told this story in other places, other podcasts, but can you tell us a little bit about how you got involved in this particular field?
Sure, it's actually embarrassing, but the more I speak of it, I feel less embarrassed. So, John, hopefully you and the audience will have fun with this. When I was in grad school, we experienced, much like medical school, you go through clerkships to feel rotations of different specialties. I happened to rotate. I had no inclination or wish to be part of helping people with chronic pain because I heard through the others who were most senior to me is like, wow, that's one tough clinic. And so I thought, oh, they're just making things up. And long story short, as I did my clerkship, I happened to see my first experience with a resident I was sitting with. And that person lost, there was back pain, that person lost their cool, picked up the stool and threw it across the office. And at that point, I made a note, I remember looking down, I'm like, not this population, for sure. And I circled it and I steered away with it. And somehow through my experiences in working in I was wanting to focus on neuropsych, brain body assessments. And that's where I came across a lot of patients who had car injuries and with whiplash and things like that, and panic attacks with body pain. And when I had my first success, by accident, by the way, I happened to be reading John Sarno's work. For whatever reason, I was a glutton for punishment to read more beyond grad school. And I started to get an experience with patients who, when they made the mind-body connection, they were able to heal beyond traditional medical treatments that had come to a standstill for them or it was not promoting anything. And at that point, I think I caught the bug and I thought, is this even possible? And then the next patient, I had some success. And as the years went by, it was no stopping me at that point.
Yeah, and Dr. Sarno's books, plenty of people who are listening have read his books. They were, sold hundreds of thousands of copies. Not everybody these days knows who he is. He stopped practicing about 10 years ago. One of my mentors in New York, who really was one of the first to really popularize the idea that what's happening in our life can show up in our bodies, and that as we start to learn more about that, that's what I think for me, probably for you, was able to unlock some for me some health issues that got better, and then we take it from there. We've learned a lot about pain science in the past 10 years since he did retire. What kinds of things have you done over time to learn more about this connection and figure out ways to help people heal by using these ideas?
Yeah, it's an endless process of, I should say, a passion of just continuously just learning And one of the things I did was I devoured every single book. John Sarno, again, I think most of us did who practice, devoured it. And then if you pull down any one of my books, you'll see markings and different colorings and dog ears. And that's where I really started, is I went through all his books. And then who came on the scene was Dr. Chapter and Schubiner, and I started to read their work. And Schubiner is very big on publishing and writing lots of articles, so that really worked. There was very little training. There was no app back then, even the word app. I might be dating myself. And that's where it really started, is really just indulging in those workshops and workbooks, that is, and really trying to practicing it. So reading and then practicing it. Now my training also is very mind-body focused. So I have a specialty. So just like physicians, psychologists are trained in specialties. So I'm a health psychologist. I'm a general psychologist who specializes in health, which is mind body. And then I subspecialized even more and into pain. I no longer say pain management, I say pain recovery specialist.
Nice. And so, you're experiencing grad school, like not this population. And so clearly that's the experience of lots of psychologists and lots of physicians. Studies on physicians show that almost none of them like treating chronic pain because the tools they have are too blunt and too ineffective. And so what are some of the things that you have grown to love about working with this particular population?
Wow, that is, it's endless and it'd take up 2 hours, but I gotta tell you, it is such a passion. What I love about that is I've come to understand them because I became one of them. So it's, I think those of us who struggle or used to struggle with chronic pain, and every now and then it shows up and dominates, and then it quiets down. And I was in a very bad accident. In fact, 2 bad accidents. One was a motorcycle and one was a car accident, where my back and other parts were quite severely injured. And as I went through it, I healed. But what was intriguing is I put myself through school, by the way, selling shoes. I'm a specialist in shoes too, at JCPenney's in San Jose, California. And so I put myself through school, and I was working full-time and going to school full-time, carrying 16, 18 units. And I started to develop, I couldn't sleep. I developed tension headaches, and my back would be just burning. And so the doctors basically said, there's nothing wrong. And I thought, and short of saying is, this might be, well, maybe it's just stress and it's all, just take better care of yourself, with little guidance. And at that point, I realized, I'm like, geez, Louise, this is how I'm going to be for the rest of my life. And recalling Sarno's books and a few other things, start to read and actually take better care of myself. And then I found a link where my emotions actually could amplify. I thought, how's that even possible? And so that's when, with my studies in psychology and mind body, just start to blossom. So being a recipient of chronic pain, being afflicted with it, and then recovering, it makes me feel very confident that more people can get better than just manage your pain.
And I was listening to one of your podcasts with Dr. Hanscom, and the two of you were discussing this concept that as clinicians, we're only able to take people as far as we have gone ourselves. And then I was having a conversation with a junior colleague the next day, it's 2 days ago, I think, who used those exact same words with me. And so I've actually been reflecting on that the last few days, what it is about our experiences that help us take patients and clients with us into healing places.
Yeah, the two things, the 2 words that just popped up in that, and that was mentioned to me in my training, in my residency, at multiple just wonderful mentors, and they practice what they preach. That's what I really loved. And so one of the things, the 2 words that pops up, and I'm sure the audience and others who are practicing like us can appreciate, is empathy. There's a difference between empathy and compassion, and there's a slight difference. Empathy is being able to walk in someone's shoes to some degree. I truly, the physicians I treat, and as we were talking earlier on, is that I have a group of patients who are just all physicians. And the physicians who actually recover from pain, their medicine practice changes tremendously. And so in the same manner, having empathy is being able to walk and realize that it is so frustrating. I call it the medical merry-go-round. It's that they're trying this, trying that, and $45,000 later in this year is there is no relief. And it's so heartbreaking because I too, like them, tried multiple things. And so empathy is walking in someone's shoes. Compassion is when I think as providers and many other patients, we shift into a call to reduce unnecessary suffering. I think that's the difference.
Yeah.
It's helped.
And, the history of medicine, there's some thought that in previous societies, nobody trusted a physician who wasn't damaged themselves. Like, this is clearly sort of before the advent of modern medicine, the way it's practiced right now. But through a lot of history, the idea was that like you only learned to be with patients and to help them heal if you'd already been through it.
Yeah, there's a lot of, basically when we put in the mileage, we tend to have greater confidence. And a lot of, because a trained therapist and master's level and psychologist to be, I have this insight into them is a lot of us who start in this field, and this is not for everyone, so I'm speaking to some, that we don't practice sometimes what we preach. We tell people how to change their thinking, but how's your life looking? And it's okay to not, always have all the answers, but when we practice our meditations, our breath work, when we educate ourselves more, when we learn to empathize and have compassion, when we practice that in our life, it is easier when a patient who comes in who's very difficult to sit there and say, let me hold you in this space. That is very key to, I think David Hanscom and I talk a lot about this, is sometimes we have our fancy degrees and our trainings and our years of experience. That ain't nothing until a patient really knows that you can hold them even when they get mad at you. So now when someone gets mad at me, and even I've had someone pull up a knife and throw an empty bottle at me, I sat there and I'm able to step back, down regulate and go like, they're just scared. They're frustrated. Wouldn't you be that way, Les? And that's when I'm able to shift. And so doing that, my patients have really come to appreciate that this is tough work. Not everyone wants to do this. It's only the ones who are courageous that wish to pursue this, right? And with passion, so.
Yeah, and so much of it is about helping people feel and create safety in our offices, safety in their own bodies, safety in their lives. And a lot of what we know about pain these days is that it's a signal that something is not safe. And so if they can have that experience, even fleetingly with us, that starts to help create these safe experiences in other parts of their lives. So, all right. So say I'm a patient of yours and I get referred to you over at Kaiser, and I know nothing about this. I'm hurt. I've hurt my back. I get told to go talk to the shrink, and I walk into your office. How do you help me begin to understand what's going on?
Yeah, a couple of things here is, I'll say this, and maybe it might be exhausting to say this, but this is truly the science behind this. The first step is to actually have compassion front loaded in the beginning. And that includes empathy and compassion, just to be clear. And then in the middle and also at the end. That's the first framework, is when I can actually hold that space. So when you know that I'm not trying to force my beliefs onto you. So actually having that cloud of buffer there, that empathy and compassion, is really crucial. The second thing is this is, and I used to be afraid of skeptical, and after about 18 years of practice, I now enjoy it. It's almost like, I hope this one is skeptical. The first thing I do a couple of things. I bring people's life into the office. And what I mean by that is I'll ask them, can you recall a time when you were just, like this week, last week, when you were just stressful? And what did you notice about that in your body? Did you develop headaches? Did you know, and did you experience the headaches? And we have the dialogue, and they're like, yeah, I mean, so what about the headaches? I said, isn't that amazing? There's no brain damage, there's no tissue and nerve, but it feels like there's a hammer inside of you. So we start to break, and I use a lot of humor in my, for those of my patients who know me, I'm kind of playful in my work because it's hard stuff. And I usually start with basic stress connection there. Now, for those who are, I treat a lot of physicians. So physicians usually don't like to do a whole lot. This is not a general statement, but just some. And so I'll use sometimes a biofeedback machine. So if they have an Apple Watch, I'll ask them to look at the Apple Watch, bring up their heart rate, and think of their workload or what they have to do with their family or anything else. And wouldn't you know, it goes from maybe a resting rate of 72 to actually 99. And I said, that's mind-body connection. Or I'll ask them to feel that the last time they had a panic attack or something, where did they feel it in their body? So I'm always connecting the emotions, the thoughts into the body. And so I use their life experiences. So before I actually put in anything in them or try to shift a paradigm of beliefs, I listen to all the cues and messages they have been sharing. And then I use that as an example. As I'm wondering whether we can pause here and then talk to you about this mind-body connection. And they usually smile and they go like, so it's all in my head. Actually, I said the correct term is it's into your brain and body. And so then we laugh, we go over some stress examples, traffic, workload, family. That usually hits well. And then I go back to something like this because it's always unhelpful to talk about negative, negative, negative. So this one worked really well after I talk about something stressful and have them connected thoughts and emotions to their body and where in their body. I asked them, I said, right now, I said, just for the fun of it, just humor me. I said, who do you feel that you really just love? And, a lot of fellows like to say their spouses and their partners and their dogs, their children. And I said, now notice what shifted in you and your body. And that's what gets them, is when I go back to love, from fear, from stress to fear to love. And that seems to kind of help them out.
Nice. It's amazing, obviously, not so much to you and me anymore, but as we look at this, how much of our experience we feel in our bodies. I was talking with a patient earlier this week who was kind of telling me this amazing story of stress and difficulty, and we were on Zoom, right? Like we weren't even in the same room, and I could feel it. Like I could feel my body vibrating and sort of those mirror neurons. But I said to him, like, if I can feel it from however many miles away, like I can only imagine what this experience feels like in our bodies.
Yeah.
And go ahead.
Yeah, I was going to say, you just remind me, just the patient, a couple of patients this week popped in. When someone has a wrath on the inside, this pressure, not because they're bad, it's because they're feeling overwhelmed with everything else. They're spinning, and it's like Groundhog's Day, Bill Murray's movie, right? You wake up and you're like, there it is again. You're trying to figure out how to get around it, and that's what it's David Hanson uses a metaphor of like your hand, chronic pains, like having a hand on a hot stove, like you can't seem to get out. So when they feel that wrath, I often tell them is, do you recognize this is in you? Because I don't believe this is who you are. And they said, no, it's not. But the wrath within you is often experienced by the wrath around. So it spills over like a garbage can. And, that has a whole different component of shame and guilt and anger. They get mad about getting mad. So, but I think that's really powerful in the sense is that's a beautiful thing. For biofeedback, they've started to do studies called biofeedback energy fields. And I never did quite believe into it. I'm trained in biofeedback. And what's really intriguing is that as someone can sit across from you, and if their breath is slow and even, you will end up becoming slow and even. It's much like that, what we learned in physics, talking about physics. You take the grandfather clocks and they go in opposite, you come back a few minutes later. So people help each other become safe. And this is what we're finding out, is this is why group work is crucial in creating that sense of safety, not just psychological, but physiologically.
Do you do much group work in your own practice?
I do, and I'm telling you this, is I love group work. It's just so cool to give everyone together. It's kind of like a tribe, a community. And my big job as a facilitator is to create that sense. I think you picked up on that word is safety, to be able to create safety. But what I'm finding out as my 18 years of experience is I don't have all the answers. I don't claim to have all the answers, but what's beautiful, patients who share their experiences like, hey, by the way, I practiced that silly breath work that you told me to do, or I did some expressive writing. They're like, hey, that really worked. Someone's like, oh, really? And they then tend to believe that. So sometimes credibility doesn't come from how many degrees and how many years, but those who are actually going through the healing journey.
Yeah, no, I definitely think that I've been working in groups for a long time. Dr. Schubiner and I when I first met him, I was starting my residency in 2005, so a long time ago now. And Unlearn Your Pain, which is his book, it was a spiral bound book that we gave to the patients who were going through a 3-week class with us. And I had some experience teaching groups and teaching classes. And so it's an area I'm very comfortable in. And so just naturally gravitated towards that. And I hear so often that people have never had the experience of being able to talk about this in a safe place. The people in their lives don't want to hear them talk about pain and symptoms anymore. And they start talking about the mind-body connection, and people tell them that they're nuts and they should go get an MRI. But it's so nice for them to have a location where they can talk about all aspects of this and have other people say, yeah, I get it.
Yeah, that's exactly right. I'm not sure if you have one of these guidelines. One of the things I tell my patients, think they're really funny. And I was telling them, I'm like, hey, listen, so no pain talk outside of this group. They're like, what? They're like, what do you mean no pain? I'm like, yeah, you know what? Then who's going to hear me? I said, this is your place. Your providers in this group or the group that you belong to, that's your haven. They're like, why would you want to do that? It's kind of like I said, it drains the batteries in certain people. And it's not that they don't love you, but if you come from their perspective, they're hearing this over and over. It's kind of like a song that's stuck. And they're like, well, maybe there's nothing to do with love or anything like that. It's just as I'm trying to protect your relationships and also trying to set healthy boundaries as a psychologist, of course, right? We like to talk about boundaries. It's important to have boundaries. There's a time and place whether to worry and things like that, just like David Burns does. It's time to worry. There's a time to come to group and share your experiences. And then when you leave, you use your family members and friends for other things like that's beyond your pain. You are more than your pain, is what the message is.
Yeah. You have your groups, I have my groups that I run, Curable has their groups. And so a lot of this work is getting done in groups. Yeah. If people don't have access to that, or even if they don't have access to a good and knowledgeable pain psychologist, what's your suggestion in terms of where they talk about it? Do you tell people who don't have that support not to talk about it with their family members, or is it a different suggestion?
Yeah, that's a fantastic, since the COVID, things have changed significantly. And I also have some patients who are just plain lonely. So with that said, if they do have a limited social support, right, is they find a safe and fun person to do that with, here's the caveat, with a limited amount of time, not 2 hours, not 4 hours, basically maybe half an hour or maybe an hour. And then here's the key part, much like expressive writing too, is then what's one thing positive that you learned about that experience, and then inquire about the other person. So there's some ground rules to keep them healthy. So it's kind of like this. It's not that you shouldn't eat sweets or shouldn't drink coffee or tea. Everything in limitations, everything in moderation. And that's the key message. And so teaching them to be introspective, like, I think I've spoken too long, let me check in with you. Mm-hmm. So safe and fun people, and not everyone has that. If they don't have that, then one of the things I have them do is actually go expressive writing. Believe it or not, that is one of the best go-tos. It's cheap, it's affordable, doesn't take long, and that would be my recommendation.
Yeah, and obviously there's a lot of people learn about the journal writing and how helpful that is for getting thoughts and feelings out, for getting emotions out, for just having a safe space to do this. And so do you work with clients? Do you have a shorter term model or a longer term model or some of both? Like, what are the kinds of things that you'll do with people after the initial introduction?
Yeah, great question. So a couple of things, it depends. Some people, so I have different couple of categories. When someone is a professional and they're super busy, if they work 10, 12 hours, that's going to be a whole different treatment plan. If someone has more time, that's a different plan, and someone is in between. So, but very often, right after they leave my initial consult is educational videos. And one of the most important things here is this: I have them listen to Curable. You're like, why? Because it's so simple. The lessons are so digestible without so much jargon, which I have learned also from Curable, which is really amazing, right? So that is an important thing. So usually treatment lasts, I guess, in fact, we looked at some data. So my average patient, if I see them every week or every other week, it's about between 3 to 6 months. The quickest I've actually treated and had pain resolved was within 4 weeks or less. But that's someone with less trauma, someone with a great support system, no financial, all the psychosocial stressors down. But on average, like I said, there's an educational process, and I work in 3 steps. I promote a paradigm shift, which translates to, let me re-educate you what pain really is about. It's not structure, nerve, and tissue. It's a whole different ball game here. So I use curable a lot in books, Sarno's books too. So re-educate, retrain the brain and body. And what's that mean? It means that I teach people to relate to the very things they don't want to relate to. Who wants to relate to a panic attack or a flare up, when you're feeling this intense headache or migraine or back pain or sensations in your body? Re-educate, retrain the mind body, just to teach you to come back home and learning that it's okay to not want to deal with this, but let me show you how to deal with it, the right tools. So retrain the brain body. And then the last thing is, which when they have that skill set, is to re-expose them using re-exposure therapy. What's that mean? People with IBS, I teach them to set healthier boundaries and learning to speak up before the body speaks. The body speaks the mind. So before that, I try to teach them boundaries. Back pain, neck pain, joint issues like that, I do slow exposure so people cannot bend down. I have them do what Schubert does is to basically, he does provocative testing, which is basically imagine it, and you go through those scenarios. I use imagination and then have them actually physically bend halfway, but then back off, and over successions to get them to do the activity that they were fearing because of pain, using all the skills and knowledge.
My favorite boundary story recently, one of my patients told me this early this year. She was dealing with an upset client at work on a Friday afternoon, and he was calling her every 15 minutes, like looking for something that she had told him she wouldn't have until the next week. And so he called one last time at 6:30 Friday night, and she said, look, I've got a migraine. I'm turning my phone off. If you need something, call my supervisor. Otherwise, I will talk to you on Monday morning. And she hung up the phone. And she and I talked it through, like the migraine did exactly what it needed to do.
Yes.
It set a boundary. She got him off the phone. She didn't have to deal with him until Monday morning. And then we worked over time. Like, how do you find the language to do that and draw that boundary so that the migraine doesn't have to?
Yeah, and I love what you just said, because I have a sentence I say to my patients: body speaks mind. Your body listens to the whispers of the things that you'd like to say to a boss, to a loved one, but you can't. But isn't that amazing that the body steps in and says, hey, let me shut you down? So it's such a beautiful process. So one of the things in re-educating my patient, which kind of brings up this thought, is basically I get my patients to look at pain as a protective, not a harmful thing. You're like, wait a minute, so my back pain, migraines are helpful? Based on that story, that is a perfect, what a wonderful built-in mechanism we have to protect us in service of keeping you alive.
Yeah, I'm a big fan of Christy Weepy, who you probably know, psychotherapist at United Center in Las Vegas. But her thought, or what she says about herself, is that like her body sticks up for her. Like if she needs something, her body is there. And
it's so beautiful and so true. So
yeah. So anyway, so you deal with people. If people come in, you have the initial session, you work with them. A number of people who are listening and are using the Curable app, or maybe have been in the Curable groups, or even people who've worked with you or worked with me, like they've done a lot of work and they're still stuck. So any thoughts about what you do with your clients who are working hard and they're just not getting where they want to go?
Yeah, so I use a 3-prong approach. It's really this is one of the most difficult parts. I'm sure, John, you've experienced this too. As people come, look, I'm doing exactly what you're telling, but nothing is shifting. It's just not working, and they tend to feel that helplessness, right? So I step in and kind of pry on 3 things. The first thing I inquire about is, what do you believe is actually causing your pain? And I go after what my structures are. Re-educate, retrain, and re-expose. And And in the conversation, they'll verbally tell me like, no, I do believe. However, I noticed that when they're in a flare up, I said, what thoughts show up? What emotions show up? And that's when the clue comes in. Because when we're desperate, our truth really rises, right? And so I look at their belief, their paradigm. What do you believe really is the cause? And it's very easy for, including myself, because I've been there, I'm sure you have too, is when you're really suffering, you really don't quite care what, but you just go back to like, I'm damaged. Doctors missed something. You know what? Where's the opioid? I should have taken the opioid. It just starts that cycle. So that's when I catch them, like, and then I tell them it's normal. And so this is going to take. So I double check their belief, their paradigm. The second thing I actually check, which is kind of a sensitive topic because I get pushback on this, but I do it from a place of compassion. So are you committed fully? Do you have a committed spirit? And they're like, yes, of course. They're great. Let's walk through your day. How do you do this? What's your morning routine look like? And when something grabs your attention, what is your intervention? And that's when I find the holes. And that's when I find the holes. Let's just say they're like, nope, I believe it. I got it. I've listened to Dr. Stracks. I've done curable. I've done everything. I exercise. I have all the curable stuff I do. So then what do you do? Here's the cool thing. The third part is look into your life. What is it you don't wish to deal with? That's the part where I find majority of my patients, they're compliant, but they have an unloving spouse. They have children who are special needs. They have financial problems, especially with COVID. They don't have family support. So look into your life, and the more you resist, something will persist. And so this is when I use a form of acceptance is you don't have to like it, want it, or approve of it. And, not but, and this is where you are. So what would you like to do? So learning to deal with your practical life problems, talking to a psychologist sometimes helps, and people that love and help solve these things for you is important. So life problems sometimes are the biggest hindrance.
Yeah. And I just heard you talk about just a second ago about the acceptance. And so I know that you trained in acceptance and commitment therapy, which is frequently called ACT. And I'm more of a CBT person, but I've dabbled with ACT. But I'm interested in sort of how you pulled those principles into this work. Anything that you particularly like from that school of psychotherapy as applied to pain work?
So I was trained also in cognitive behavioral therapy, and as we were talking around, David Burns, what a phenomenal person that takes this complex stuff and makes it fun and really cool. So that's awesome. Always nice to talk to someone who knows this language. I've shifted over to, and I do use cognitive behavioral therapy. There's an overlap. Acceptance and commitment therapy, as you said, is called ACT. Is basically two things. It's uses mindfulness and it's value-based behaviors. So basically, we use the mindfulness to help become aware, to wake up from what's controlling us, and also to loosen the grip of the mind using different interventions. And then we use value-based behavior. What's that? So I wish to be compassionate to myself during this flare-up. What's that look like using values? Now, what's the action behind that? Oh, I'll put my hands on my chest and I'll say, it's okay, we're gonna get through this. So ACT teaches you behavioral skills to reduce the influence of thoughts, emotions, and physical sensations. But the real fun, since you asked that question, is when I use metaphors. And I love this. And John, I'm not sure if you do this, but before COVID, I will get a rope and my patients get concerned when I come up to we have like a U shape, come up to the middle and I'm like, someone need a volunteer? I said, let me show you what your mind, body does sometimes, your emotions do, your pain does. Someone will pull, we play tug of war. And then I teach them how to drop the rope, and that's a metaphor of ACT. When your mind, your body is just overwhelming you, learn to drop the rope and get grounded, and then use other interventions. Quicksand. So I teach my patients when you're feeling a panic attack or the pain is just overloading you or a difficult thought, the more you actually make contact with, so counterintuitive, the more you make contact with it, the more you float. In quicksand, so that's another metaphor, the more you fight, the quicker you sink with your thoughts and emotions. So ACT has a bunch of hundreds and hundreds of cool metaphors and conversations. But what I like about it, it's not just talk, it's lots of demonstrations.
And I think one of the, again, I dabble, but one of the things that I learned from it so far is this idea that we can't solve internal issues using external strategies. And so I have a lot of patients who are highly successful, like powerful professional people, and they've gotten there by pushing harder, doing more. And I think in the ACT language, like if there's a problem, they just figure out how to solve the problem and get rid of it. And then we get into these places where we've got these internal physical issues or psychological, and like I can't cut off my arm because my arm hurts, and now I need a different strategy. That if I've invested most of my life working harder and figuring out how to do it better, all of a sudden that strategy isn't helpful, and I need something different.
Yeah, in ACT, we call that control is the problem. And so my patients go, so wait a minute, so I shouldn't take action on anything? No. In the heat of the moment, when you try, and Wagner at Harvard is famous on this, is where don't think of a white polar bear. And the more you try not to force it, you spend so much energy. And pretty much we do this experiment. And so if your listeners are laughing along with us here, when you get caught up in a thought, it's pretty much, this is what you do. You cannot see anything past you. And so what ACT teaches you is, can you lower that and actually keep moving forward? So basically, the more we struggle with what is showing up and we don't have new skills to relate to it differently, that's when the power struggle takes over. That's when we try to control. So when something shows up like a severe pain or a panic of thought or a memory that shows up that's really difficult, it shows up. The goal here is to step back and watch it. And so what people tend to do traditionally is to push it away. So it's counterintuitive to make full contact with it and realize that that's just a thought. This is an emotion that's showing up. Let me be in the middle of the tornado, which is my metaphor I use. And that's pretty much ACT in action. Wherever the tornado goes, you're right in the middle. It's the most peaceful part of it.
Yeah, the language part is particularly interesting. For a variety of reasons, I picked up Lorimer Moseley's textbook on pain just recently. And so you would think I would have read it long ago, but I don't know how familiar you are with their work.
I am very familiar, yeah.
And they talk a lot about it too, like how do we use the language, and especially how do we use metaphor to help people understand.
And that's another big part of ACT is what creates a lot of our suffering. I call it unnecessary suffering, is basically the language we use. Oh, this is killing me. This is going to be a bad day. And Lisa Feldman, who's a famous neuroscientist, says, as Schubert talks a lot about it too, and you have talked about it too, is predictive coding. The brain is always predicting. So why do we want to add fuel to the fire? So let's kind of neutralize it. And that's what ACT does. ACT is basically a form of behavioral therapy that desensitizes you from difficult thoughts, emotions, and sensations.
Yeah. Lorimer Moseley has a story that I was just talking to one of my colleagues about, that one of his patients referred to his spine as the Roman ruins. That's like how he talks about it. And like he talked about it that way. His physical therapist talked about that. His wife talked about it that way. And so if we keep giving ourselves this message that our body is broken, we start to believe that our body is broken. And so we have to revisualize that. We have to think about it in different ways, and we have to practice. And I think that group, Moseley's group down in Australia, would say that, if we've done this for a long time, if we've thought of ourselves as broken, if we've thought of ourselves as the Roman ruins, our brain cells that do that become bigger, and it just takes some time in order to shrink those back down and replace them with other cells that have. I
love this. It brings up a study that I used to have this in my office, I made it larger. So when patients are looking at me, on the side, they can see this study, which I've printed larger. It says complaining increases the size of your amygdala. And it always begs, hey, what is the amygdala? And I call amygdala Amy. And so, because it's just so much easier, right? And so when they say, so complaining reinforces what you said, the language we use when we continue to complain. So there's nothing wrong in complaining, but don't get drunk in it. It has physiological manifestations is what it does. So.
One of my patients, I actually interviewed her. So she's a previous guest on Hope for Healing. But when she first learned about this with her migraines, she heard that the amygdala would get active in states of pain. And so she created her own visual metaphor. And I'd say this to patients, like sometimes my patients get caught, like, where's the amygdala? How do I picture it? What does it look like? Like, what is it attached to? And when people get sort of that caught up in the actual physiology, oftentimes it backfires. So my patient found that, like, she started to get a migraine, and she would quiet herself down, and she would visualize the migraine, or the amygdala, which she anthropomorphized into this little blue Muppet that didn't really have words, but would kind of come out of its cage and be snorting and turning around and fighting. So she'd go in and she'd pet it and say, thank you.
I love it.
Yeah, thank you. And they'd spend some time together, and she'd thank the amygdala for like trying for 40 years to capture her attention with this migraine language, but she's an adult and she's got it now. And she would pat it on its head, and it would snort and fight for a little bit more and go back to sleep in its cage. And by the time she'd done all that, like,
I love that. That's great. One of my patients, sounds like we might have the same patient, because this patient said, had a newborn who was fussy. And so she came up with swaddling the amygdala, which was how interesting is when people just use their skill sets and their healing powers. That is awesome. That is awesome.
So, all right. So you and I are clearly not the typical practitioner in this regard. And so there are a lot of physicians who don't understand pain science. There are a lot of psychologists who don't understand pain science. And so my patients will ask me frequently, several times this week, and several times every week, how should they talk with their other clinicians about what they're doing? And so, so any thought from your standpoint first about, say, patients who are working with a psychotherapist who maybe they like, but isn't necessarily up on what you and I are talking about here? Is there any way that you've found that people can convey what they're working on to their own therapist in a way that's useful?
Yeah, I know it's one of the conundrums. I have lots of colleagues in psychiatry, mental health at Kaiser and other parts. And when I send a patient over, I said, this person's really suicidal and they really need some additional work, or there's trauma, let's work on the trauma part. Now, when I send them over, they send them back and say, well, the reason they're having such depression is because of their pain. So there's this. And so I said, how about this? Let's tag team, because the real truth is, in science and in our practice, when something shows up, it doesn't matter, it's moot, no matter what came with the chicken or the egg. With that said, one of the most effective tools, again, coming back to I'm a very practical pain psychologist, is education. A lot of therapists and physicians alike, and other allied professionals, including physical therapists and nurses, they know that there's a mind-body connection. Much like in medical school, you guys are taught this at some level, whether it's a one-time lecture or when you guys go in residency, is the biopsychosocial. And it's almost like it's this myth. So it's almost like the physicians talk about the bio and like, yeah, I know about the psychosocial part. So what we do, the most effective thing is I have my patients have their providers look up Curable and just listen to those lessons. That is the most and the quickest way I've done it. And or basically just to have them just kind of print out from the PPD. So when I have them work with physicians or therapists, there are two places where I usually send them. Is Curable and the psychophysiologicalassociation.org. That has been my saving grace, because it speaks to the physicians, and Curable just makes it so easy for a therapist or physician to go through those lessons real quickly.
And you're talking about those first educational lessons in the Curable app. And
very effective.
Curable, I think, now has an official program where clinicians can get access. They don't need to buy a subscription. And I think it's curablehealth.com/clinicians. And
very effective.
And they can also then give their patients, if they've signed up for it, they can give their patients 6 weeks of access.
And that I've been sending to my colleagues, and of course they get intrigued with it. Anything free is fun, right? And so, but what's even more is the fact is there's a buy-in. And I think the message here is this: whether a physician or therapist or psychologist, everyone has good intentions, but we forget the model, the biopsych. It takes, we're not a mind or a body or just a head or a part. We are whole. And that's the message. I think we learn this intellectually, but when it comes to clinical practice, some parts fall off. So having a re-education is always the best route to go. And one of the things we're doing is folks like us, we're out in social media and others, we're trying to educate anyone and everyone around the world, not just providers, but also patients.
Yeah. Do you think it's any different if the clinician that our patients, our clients are working with is their physician as opposed to a psychologist? Do you think, in your experience, physicians any easier or harder to talk to about
Yeah,
this?
this is going to sound weird, but hopefully my colleagues don't get mad at me. So here goes. Actually, mental health therapists, and not all of them, again, just to kind of let everyone know, it's we, because I'm one of them, we believe that if the doctor says it's a herniated disc, that's it. If the doctor says it's complex regional pain syndrome or fibromyalgia, that's it. But I was like that 18 years ago, even with all that training. And we believe that if the doctor puts a fancy diagnosis, that's pretty much, I need to teach them to manage it. And that's the part. So therapists, mental health professionals, that's the part that tends to be the hardest, is we don't have enough of the biology and the physiology. Now, in my training, we have a lot of neuroanatomy, physiology, so I'm a little bit different. However, but I can appreciate my colleagues, because we believe when a doctor says, this is your diagnosis, we'll go, okay, so let's just kind of go with it. But other experienced therapists do know is that things can change. Physicians, they're tell me what it is, what do I need to do? And they're really, really good. And a lot of the Kaiser physicians I work with and specialists in spine, and in my department, my chiefs, the physicians I work with, they're all trained in meditation, mindfulness, ACT. I mean, they practice what they preach. So they're like amazing.
That's amazing. How do you get them to how did you get them to want to do that or require that they do that? But
it's great.
Yeah, if there are clinicians who are listening and they want to go, the Curable app is great. The Psychophysiological Disorders PPDA Association is great. What if people want to go even further and sort of learn some of those skills? How do you guide them?
Yeah, so that's and this is when Schubiner has been my saving grace, because he started training providers. Howard Schubiner, and his website, I believe, is Unlearn Your Pain. And he's been a great, he's at multiple, and Alan Gordon, of course, is part of this advisory board, is great. He's funny as heck. So the training from these guys are really important. And one of the things with my physicians, I've had a relationship with them for a while. And here's the funny thing they did some umpteen years ago. So these spine guys would send me some difficult patients with sciatica, herniated disc, just basic stuff. And they'd say, and then patients got better. And every time a patient got better, I'd say, thank you for this referral. And by the way, pain resolved. They're like, what do you mean pain resolved? I said, no longer dominant of their life. And they're like, are you sure? So I'm like, yeah. So the patients will email them. So I usually tell the patients is let your physicians know who are treating you that things are better. And that was another component. So basically having the experience and showing them. So when we treat patients and the other providers don't hear from us, so therapists, psychologists, physicians, when you get a patient better, even 50% better, send a note saying, thanks for this referral. By the way, pain is less dominant.
It's hard. It's hard for physicians. We spend so much time training in illness and sickness that sometimes when people walk in with health, we don't always know what to do. And so my patients sometimes have that experience of trying to tell their physicians that they're feeling better. And the physician's like, are you sure?
That's exactly it.
Yeah.
It's okay, because I get referrals now, and but that's why it starts. It starts with that one patient, is because that's how we don't try to force people to believe. It is through actions and through just kind of hearing why they think what they think. I get referrals now from surgeons who said, I've done 3 surgeries, they still have pain. And they say, well, and then they go it's neuroplasticity, and so they go with a fancy term, and that means the brain is changeable. And ultimately is when I've worked with surgeons, especially and specialists, and basically send them message back is, yes, it has some accountability, but their life basically is in shambles, because we need to calm that nervous system down. So that's the buy-in, is through evidence and just understanding where they're coming from.
Yeah. We've got a few minutes left. I want to take a couple minutes, if we can, and talk about the polyvagal theory, which I know that sort of is an area of interest of yours, but can you describe briefly kind of what this is about and what it means to people?
Sure. Love to talk about that. And so simplified, it's actually quite complex when you read Stephen Porges's books, I should say, and Deb Dana's. In simplicity for the audience and time's sake here, think of the polyvagal theory as a brain-body science of safety in service of health, growth, and restoration. What does that mean? It basically means this. When we feel safe, the polyvagal theory says, and we're connected with people and things that we love to do in life, that matter in life, your nervous system calms down and everything within you changes. Your body starts to heal, your narratives change. That's the short end of it. But the message I want to send the audience here in the last remaining minutes here is that when you look at the nervous system, the polyvagal theory basically gives us an updated version that both of us have learned and about the nervous system. So the update is to be simplified here. Think of 3 levels of the nervous system. Safety, when you feel safe, your narratives are, I can do anything. And when you're feeling safe and connected, healing is possible. The second level of the nervous system is when you're feeling scared. So you'll notice that the S's, safety, scared. When we're feeling scared, we're in fight or flight, and we're basically producing inflammation in the body. And the narratives in there is like, I must do this. How do I do this? There's a desperation. And the bottom of the nervous system, which is Porges has really taught us that when we cannot fight or flee from life problems and what's inside of us or what's in between us, we shut down. And that's called when we shut down. Safety, scared, shut down. And clinicians refer to that as freeze and collapse. There you are.
And yes, and freeze and collapse are different too. This is what I teach people also. Like freeze is a high energy state because people are looking for the opportunity to fight or flee if they can, and collapse is a low energy state, and we get there for different reasons. And so then what's the application of this? The fact that we know this is great, and that my understanding and my research has shown that we've really sort of pushed forward our ability to harness this in ways that are useful. And so what are your favorite ways of taking the polyvagal theory and then using it to help patients?
Yeah, John, if you hang out with me, I have acronyms all day long. So please, hopefully the audience won't get too mad. So I use something called the 3 N's in application of the polyvagal theory. So if you got the first part of safe, scared, and shut down. So how do we do that? So one of the things is awareness is a gift to all of us. So it's hard to change when you're not aware of what the problem is. So the first N is called notice. Notice that there was a mood shift or tension that showed up. That's the first step, is awareness. It's like putting on a spotlight in a dark room. You wake up. The second N is basically name. Name what? Name the hierarchy you're on. And it's really amazing. So today, John, when you're out about your day or the audience, when you notice yourself getting defense, you notice your mood shift, you're now in sympathetic. So just literally noticing it, naming it, calling it out. Research shows out of UCLA, when you label something, it deactivates the limbic system, the fired up system, the survival system. So notice, name, I'm in sympathetic, or I'm feeling scared right now, or you could even simplify it. So this is what anger feels like. So this is what feels like frustration feels like. Then what's the last N? Nurture. How? Drop into your breath. Why? Because when you breathe, it's the remote control of your nervous system. You downregulate everything, and then your frontal lobes come back on. You can go like, okay, I am kind of feeling overwhelmed. What can I do? Breath is like a hug. Since we're talking about Amy, the amygdala, breath is like a hug to the amygdala. And so to your mind and body, and it provides safety in that sense. Breath actually tells the body and brain, me safe.
Any specific kind of breath that you teach people?
Yeah,
or?
I do. The couple of them, the 2 most frequent ones I teach is basically called easy breath, 4 counts in, 2, 3, 4, just hold for about 2 seconds. And then for a longer breath out, 6 counts. So in for 4, out for 6. And if you do that, you'll breathe about 6 breaths per minute. And so what's that got to do that? When you breathe in that coherent, resonant breathing, it actually stimulates the vagus nerve, which sends messages of safety to the brain, like we're safe, even though bad things are happening. The other thing, breath technique I teach is something called the 470 that most of us know. And so that's a nice way to unwind. So I call it the SOS. I think Curable has a cool one too, where it's SOS. So basically, breath work is, I use one for SOS for just those moments where you feel like you're about to say the wrong thing. You're feeling like this pain is not coming down. So that's when I use that. But for the most part, is I teach patients to basically stay in their breath for at least 5 to 10 minutes a day, just noticing your breath. Doesn't have to be fancy like that. Just watch your breath for 5 to 10 minutes.
And I think there's data that says that if we can name the emotions, and so that I think was the second there, that calms down Amy the amygdala also. Yep. And so that those studies and showing that, like we say, this is anger, this is fear, this is discouragement, and then coupling that with these relaxing breaths. And then we know from studies that if we can calm down the amygdala, we calm down the symptoms.
Yep, that's it. That's absolutely, it's kind of fun when you know this, and it's harder to practice it. I think we both can speak from personal life experiences and patients, but the reality is the more you practice, I have a saying, practice is the drive changer of your nervous system, which means your brain and body. So
you and Dr. Hanscom, I think, have a workshop or an intensive coming up, correct?
Yes, correct. May 22nd. And I love hanging out with David. He's so funny. Even I tell him it's surprising as a surgeon, he's funny. By the way, on a side note, he did take comedy classes, stand-up comedy. So he's getting better at it.
That's good.
Yeah, so we're basically putting on a 3-day weekend workshop to show how groups can actually help people heal. And we're also putting it up with Babs, his wife, and his stepdaughter, Jazz. And so it's kind of fun, and they have other artwork and things that we do. So we're bringing sort of this mind-body work over a 3-day period, and to help people just shift into this mode of safety.
Good. And if people want more information, where should they?
Great. They can go to opencenter.com, and so they can take a look at that, or they can just Google David Hanscom and Les Aria. They'll show up.
Mm-hmm. And you have a mindfulness channel too, correct?
Yeah, I started that out John. I started out of frustration. This is when COVID. Don't we start things out of frustration? Yeah. So I didn't want to fight the system. A lot of my patients were losing the insurance when COVID hit. And I felt so bad and so helpless, and I wanted to find a way of actually promoting some sense of wellness and well-being. So I started something called the Mindfulness Channel. It's just a play, so it's MYNDFULNESS. So a Mindfulness Channel, and people can find me if they just go to YouTube and type in Les Aria, and that is mainly for people who are losing it, and then the insurance. And as time went by, I just started to bring in some experts. I even interviewed Stephen Porges of Polyvagal. This coming today, tomorrow, we'll be posting a YouTube on James Pennebaker, the guru, who came up with the study of expressive writing. So, yeah.
Nice. That's actually how Hope for Healing got started too. It was the beginning of pandemic. I was like, gosh, what can I do that's going to be helpful? And so one of my patients who was the first interviewee, she's a mindfulness meditation instructor and a self-compassion instructor. And so like we got on the phone, just did a conference call a couple of times to do some meditation. And then we told that to Curable. They're like, oh, you should come on Curable. We should do that. So the first two were specifically aimed at just getting people some relaxation in their lives at the beginning of the pandemic.
And it's been helpful by just for the listeners and therapists and clinicians and physicians, is I actually have my patients listen to you in this, because we all need a sense of hope. And that's why I love the title of it. And during this difficult times, we actually need something to look forward to. So the more we hear people get better, the better it is. So it's a beautiful channel in that sense.
So my last question for you, and then we're going to sign off, is you've talked a couple times about playfulness and humor, and I think you guys even are going to emphasize that in your intensive. Most people don't think about chronic pain as a humorous subject, and clearly it's not when people are suffering. And so how do you bring in the lightheartedness, and how did that get developed over time, do you think?
Yeah, it's great. I was trained in CBT, and one of the activities is get into pleasurable activities. I'm like, yeah. So I just assign my patients, go do something fun with that little science set. This is 18 years ago, by the way. And so now we have science using Polyvagal Theory. Check this out. When people play, even when they're having terrible time with pain or just their life, when you engage in play, it requires sympathetic, which is energy. And when you start to kind of connect with people, that's ventral vagal. Those are technical terms. in a language we just used a few minutes ago, is when you're feeling scared, when you're energized, and is using your word, energized, and you connect with people, you actually shift the nervous system into a state of safety. The vagus nerve, so basically play, humor, stimulates the vagus nerve, and that promotes that health, growth, and restoration part. One of the quick tips, I work with lots of physicians and super busy human beings afflicted with pain. I tell them is pick up YouTube, search for something for 10 seconds to laugh. Every single day, and I like to practice what I preach, I try to have a belly laugh, and I send those funny YouTube videos to other people. Yes, it can be those cat videos, that's okay, but it can be anything. But for the most part, you can even recall things of, animals. When I put peanut butter on my dog's nose, Bentley's my dog, chocolate lab, and it licks over and rolls over, and we just giggle. And so it's important. Even though we're struggling with chronic pain and in the journey of healing, play should often be a prescription given to patients.
Alan Gordon, actually, who we mentioned earlier, runs the Pain Psychology Center. He's got a funny story about Howard Schubiner, who's a funny guy too. And he said he was talking to Howard, and Howard said, gosh, I love public speaking. And, if every time I go out there, if just one person, and Alan was sure he was going to say, like, if one person gets one thing from my lecture or just advances it, he said, if just one person laughs at my joke, it just makes it all worthwhile.
I think that's great. I think that's awesome. Wisdom right there.
Any last thoughts for people who are listening, people who are at the beginning of this journey or in the middle of it, or trying to find the next step?
I think that it's something that we both probably really emphasize to patients is that be a prisoner of hope. Really, this is very crucial. That's one. And two, we thought the world was flat once, and now we know it's round. So with that said, pain recovery is truly possible, and I hope you give yourself that opportunity.
Yeah. So we will end there for this evening. Les, thank you so much for being here and sharing your experience and wisdom. I know how much people appreciate listening to you and being able to tap into what you've learned.
Thank you so much, John. A pleasure being part of this whole family.
Good. And thank you to everybody else who's been out there and listening. Every time we record an episode, I'm reminded of how blessed and touched I am to be part of this community and be part of a community of people who are working hard and being brave and entering into this method of being able to heal. As I said earlier, I've expanded my telehealth options during the COVID pandemic. And so people who are interested in meeting with me can request information through my website, www.drstracks.com, and my staff will get back to you with all the details that you need to know. And if you enjoyed this episode, you can find this recording and all our previous Hope for Healing episode at Curable and my landing page, curablehealth.com/Hope for Healing. You can also sign up for either of our newsletters to get updates about next episodes and everything that's going on with our practice. So I'll be back in 4 weeks on Wednesday, June 9th at 5 p.m. Central Time. I hope everybody can join us then. And until then, I hope everybody stays safe and healthy, and I hope everybody has a good evening.